The next case that I want you guys to open is it's called like tiny tumor or some. Yeah, please. All right, so this one is a very, very, very humbling case. Actually, my advanced imaging fellow had to present this in a sort of multidisciplinary discussion of it. This is actually a 30-year-old female who developed ventricular tachycardia. It is the first time I've ever said to myself, thank God she had VT. Thank God she had VT, because a VT, this VT that they couldn't really ablate, led to a cardiac MRI. The cardiac MRI was more for VT ablation purposes to see if we can find anything to sort of localize where the VT could have come from. And thank God the MRI, and I will show it, that's the next slide, Tarek, showed, and I wasn't going to make you guys find this on CT, but they found something like that. So what do you guys see? They're striking there. There's a mass. It's attached to what? Papillary muscle. Yeah. So we saw that on MRI. So now go to the CT. I wasn't going to make you just blindly try to find a mass on this case, because that's the very humbling part of it. I did want to show you how and where it was on MRI, because this is the reality of clinical practice. We will have other imaging tools to guide us and try to find it. So what I want you guys to do is go to your CT and sort of orthogonal, make a short axis and go down those papillary muscles and find the mass. So I'll give you guys a few minutes. And this, again, is very humbling to me, because if I would have just had a CT, I'm like, gosh, would I have seen this, right? Would I have even mentioned anything if this was just a regular coronary CTA? And I'm just, I don't really have any information about the patient or any other imaging tools. Would I have mentioned anything? So I think Tarek there is doing a great job sort of delineating it there on our 4-chamber and on our short axis. Did you guys find it? Do you guys see it? It's insanely humbling how small this is, right? Well, the reason why I say thank God this patient had VT, she went for surgery and they resected it. What do you guys think this was? Blurt out. Blurt out what you guys think it is. Monomorphic. What do you, just based on what I've said so far and what you see on CT, right? And then what thing did I say during the lectures that's very important to know, right? Contrast enhancement, right? Which we don't have in this case, but that is an important thing to look at, right? Does this tiny mass have any sort of contrast uptake or not? And so go ahead and go back to my slides. And this is why it's very humbling. So she had surgery. It was resected. Thank God, clear margins. She's only 30. And so potentially she will be cured from this. So it was a leiomyosarcoma. So insane case. And so that's why I wanted to show you a very obvious mass case and then the more humbling tiny tumor cases. But any questions? You guys are getting really savvy with Terra Recon. Compared to day one morning, right now seeing you guys maneuver the clicking and going through is really great. You guys are doing a great job. And so with that, I thank you so that we can move forward. Thank you.